Hi everyone, and thank you for taking the time to review our policies and procedures in order to have an easy and complete system. This ensures that we are giving our families the best quality of care that we can. Please keep in mind that you will be receiving a questionnaire post this video so we can feel confident that you are well versed in these policies. You will also receive a document detailing the information in case you need it for reference. Today we're going to be reviewing some of the documentation for TherapyBOSS. Now, there are two sides to TherapyBOSS, the website and the app. Today, we're going to be reviewing the app and the first day of paperwork with a client. Here I am pulling up the app on the screen, and I'm going to be logging in. At this point, you are going to see your different options on the screen, and you will click on Patients. I have loaded some dummy patients for this purpose, and I will be clicking on Test 4. Now, once we have our patient pulled up, we are going to be looking at the patient demographics to get a general understanding on what's going on. We will click on the scroll down menu and click on Demographics. Here we will find some information about the patient, their name, their date of birth. Here's where you're going to see details on what's happening with the family. You'll find information on the diagnosis as well as which care manager you should be reaching out to, what's going on with the family. Most notably, you're going to see View Attached Paper Document. Now, in this case, this will always be the SDD form. You will be printing it out before every single session. How to fill this out correctly is covered in a separate video. We will now be discussing the first session with the client, in which you will be filling out what is called an assessment, but generally means an intake. We are going through each item in the assessment. First, you're going to be clicking on a new visit activity. You will be choosing the date and time that you are seeing the client for the first time. In this case, we will be saying that we saw the client at 5:30 p.m. And the type of session that we are going to be using is called the assessment. This generally means an intake. We will be clicking Save. And here we will be clicking Add Notes. The first thing that you are going to be adding is the admission consent. This will be pulled up at the time of the session when you are leaving the session. You will be showing this to the parent and you will be letting them know exactly what's on it, and they can sign it on TherapyBOSS itself. Let's click on admission consent and you will see that it comes up with the rights and responsibilities of Silver Care, and these you can review with the family. They're very detailed. They explain exactly what the client is responsible for. There is also in here the authorization to release confidential information to the care management organizations, the MRSS, etc. And on the bottom it will say that the client has read the responsibilities and they are ready to sign. On the bottom left corner over here, you will see 0 minutes. You will actually put in however long that first session was. For example, in this case, we're going to say 120 minutes, and we're going to click OK. It still says not signed. You will pull that up on your app, on your phone with the family. You'll click on not signed, and the parent can actually sign it on here. They can either do it with a finger. If you have it on an iPad, they can do it with a mouse. But in this case, I will sign it over here and we will click OK. So now we have our admission consent and we have it signed. Take a look at this red dot over here. If this is red, it means that you did something on this form that is not completed. What they are talking about here is the question of if the patient decides after reading this that they want to refuse services. But in this case, obviously the patient has signed, so that is not applicable. You would click off NA. It now turns green and you click Save. Now, the reason it is saying that we need to continue working on this is because you still need to fill out your social work evaluation and your session note for the actual session with the family. Both of these can be done at home. Just the admission consent has to be done with the family there because they need to sign it. So in this case, we would say save, work on it later, and we would assume that when we get home, we are going to pull up test 4 once again, and we are going to go back into documentation. We have the social work evaluation going on right here. We're going to click it. We are going to click the unlock button, and now we are going to click change. The reason we are changing it is because we are adding an evaluation here. So here you are at home and you have your time frame to review and record what you feel the intake information is for this family. So we are going to add note and we are going to click on social work evaluation. We are going to go slowly through each part of this so that we can explain exactly what each thing is needed. Let's begin with reason for evaluation. That is, it will always be initial because we are starting off with the session. And we will discuss in here, what the reason for the initial referral was. Click OK. Now, the pertinent diagnosis actually already comes up here because it was in the original client. It will usually be filled in automatically. If you have something to add or change, you would just click on it and change that. But right now, it's already put in for that. Next would be learning obstacles. So if there are some learning obstacles that you feel are important in this situation, you can click them. If not, you would click none. Same for social conditions. If you feel that any of these are applicable, click them off. If not, you would click no social problems. Mental emotional status. These may be more applicable to some of your clients. Do they have feelings of guilt? Are they anxious, fearful, overwhelmed? Click OK. You will then do the cognitive status. If you feel that they are not oriented or etc., you would put those in. If not, if you feel there are no problems, you would click off no problems. Most of the next 4 or 5 are not going to be applicable to your clients. That's why we're going through these together so that you can see what seems to be and what is not applicable. So for example, physical ability is usually not an issue with our patients. So we would just click no physical problems. ADL management is usually for elder and we are working with children. So we would do no functional problems, living arrangements. If this would be an issue, obviously you would click it off if there is a problem, but if not, you would click no issues. We are assuming no environment safety unless obviously if there is an unsafe home, etc., you would click something off. Otherwise, no safety problems. Financial status, again, this is for children. Often it's not an issue. However, if you feel that the family in general is having some of these problems, you would click them off. In this case, I'm going to assume no financial problems. Caregiver support. Again, this is generally not an issue for you who's going in to see the child or the parent, but if it is, click it off. Here I'm going to say no, and certainly community support, I'm not going to necessarily click off. Here it does have community agencies providing support. If you feel the family is utilizing YMCA, etc., you would click it off. Advanced directives. This is not applicable to our clients. We would click off no, no, and no. There should never be any other change. There should be 3 no's by DNR order. Additional observations. Now keep in mind as we're going through this, if you see it's still red on the top because we have not completed our intake because most of these are not really applicable. Here's going to be more the pieces where I'm actually going to be wanting you to fill in what you feel is the issues. But this will stay red until everything is completed as is needed. And if it's still red and you don't know what's wrong, you would click on it and it'll tell you what you're still missing, okay? Let's go back in. We have here additional observations. Here is where you might put in certain observations that you are finding within the family. If you do not have any, you do not have to put in any if there are not additional ones. Here is your care plan goals and your care plan interventions. This may look familiar to you because we used to have this as a separate treatment plan. Now this is included within your initial evaluation. So we will click on care plan goals. Now there are a couple of new things with care plan goals that we'll be reviewing in this. So we are, for example, over here, we're going to assume that we have an ARC-RO case, so we have some goals here. The main piece to remember is that these goals and interventions are for a 3-month time frame. What that means is that we are not expecting you to have more than 3 or 4 max goals for a 3-month time frame. It is irresponsible and untrue to expect to have 20 things covered within 3 months. So we would assume for goals that we're looking at maybe 3 goals for, if we want to say we're doing 2 goals for ARC-RO and 1 goal for anxiety. But overall, you should be looking at between 2 to 4 goals in total. Click OK. And you are now going to be looking at care plan interventions. Okay, these may be more. This would not be only 2 or 3. What it will be is 2 It's 4 altogether per goal. So if let's say we clicked off 3 goals, it would be 12 interventions. However, keep in mind, 2 of your interventions for each goal should be measurable, which means that it would have a number in there, and 2 of them can be non-measurable. So let's take a look at what that looks like. We chose 2 goals in ARC row. So now we're going to need to choose 8 interventions in the ARC row. Okay, so we're going to look at, this would be non-measurable. There's no number in here. This would be immeasurable because it has actual techniques in there. So we have 1 measurable. This would be immeasurable. So it would be 2. We would do, this would be a non-measurable. Let's see, altogether we need 1, 2, 3, 4, etc. I'm not going to go through them because I would want you to actually look at them, but keep in mind that measurable means, even if it doesn't have an actual number in there, it means that it's very specific, while non-measurable is a little bit more of a broad spectrum. So you want 2 and 2. Now let's look at the anxiety, which we chose 1 goal for anxiety, so we're only choosing 4 interventions here. And keep in mind that you can always add your own interventions. These are just templates. So if you feel that you need more or you need more measurable, that's fine, absolutely. But in this case, we would say this would be a measurable, this would be a measurable, this would be a non-measurable, and this would be a non-measurable. You may see as we go through this, we may go back in and tweak the templates a little bit more to have more numbers in here. So when you go through them, you'll see more of numbers versus not numbers. Another very important part of our new piece will be the strengths. You must choose 2 or 3 strengths for the family. That is a must in every single assessment that you're going to be doing. So in this case, I'm going to choose off that they are a good listener and that they have courage. Okay, we now have all our interventions. We have all our goals. This is a huge part of our piece. We are now going to be doing visit frequency. We are going to set the frequency for this episode. That would mean in this case, we're going to say we like weekly rather, and let's say we are assuming that we're going to be seeing them once a week, and we assume that we're going to be repeating that for 12 weeks, right? In the beginning, we usually have, 2 hours a week for 12 weeks, and you're going to click save. Click OK. The rehabilitation potential, that is, do you feel that this child or mother or father is able to, do you feel that they have a good rehabilitation potential, fair, etc.? In this case, I think this child has a good chance. We're going to click good. Discharge plan. When are we going to discharge this person? When the care plans are met to the maximum potential, and we are going to discharge to care of either caregiver or physician. Here we are going to click off the check that it is discussed with patient and caregiver and agreed upon. And, oh, I thought I was done, but take a look. Here we have a red dot, which means that caregiver support. We are missing that. So let's take a look at where we don't have that. If you just click on it, by the way, it usually will go straight to there. Here it is, caregiver support. I didn't click no support problems. Now we're green, fantastic, click save. They're still telling us that we are missing something. What are we missing here? Remember, this is only for the first session. After this, it gets simpler, I promise. We are missing a social work session note. That we are going to work on in the next video. Here we have the social work evaluation with just the 2 pieces of the admission consent and the actual evaluation. We will look at the session note in the next video. Thank you so much for watching.